Hey everyone, it's Scott again from Strive Labs coming to you with another Tuesday tip. All this month we're talking about patient engagement, and this is a subject that's near and dear to our hearts here at Strive Labs. We've been talking about patient engagement for going on years now, and what I want to talk to you about today is a specific subsegment of patient engagement. It's actually relates back to some older tips we've done on patient retention. Specifically, how can you start to leverage some of the tools that you have that help you monitor patient engagement? How can you use that as a method for really checking in on your existing patients while they're going through their course of care and figuring out who might be at more risk of dropping out? We call this concept proactive engagement monitoring, right? It means how can we monitor engagement proactively to make sure that we're not having patients drop out of care? Really, how can we start to see what the common patterns might look like of a patient who might be at higher risk of dropping out of care? So I'm going to show you how you can use a lot of the features that come with the new Strive Hub Prescribe module and how those can be used for proactive engagement monitoring by an individual therapist. All right, so let me dive on in here. So again, this is Strive Hub Prescribe. We're going to be releasing a lot more information about this. It should be coming out within the next month or so. And one of the exciting features about Strive Hub Prescribe is it gives you a lot more granularity on how your patients are actually engaging with the tool. Now again, this is sort of the exercise database, and it's pretty handy. It's really easy to create an exercise routine in under a minute. But as we start to think of the next evolution of the HEP, it really starts to become a lot more about the patient's experience with care rather than simply just a module to create an exercise program. So if we head on over to the Patients tab here, what you can start to see is some really interesting data about your patients, right? So what we've got is we've basically got some summary stats right up at the top, right? So okay, over the last 30 days, I've created 26 care plans. I've got a 30% engagement percentage, right? Which means 30% of my patients are meeting the minimal engagement threshold here. They're actually utilizing the tools we give them, which is okay. 6%, or excuse me, 6 logins per patient. We can actually see how many times those patients are logging in. And then we can see our net promoter score over here, which that would be a pretty darn crummy net promoter score if that was actually you. We would say there's probably some things we could improve there. But again, we actually give the therapist the ability to monitor that NPS in real time just for their patients. So this is pretty neat. Additionally, with each patient, what we're going to do is we're going to just give you some summary data. This is all pulled in from your EMR system. No need to double data enter. And so what ends up happening is you get their eval date, and you start to see some interesting things, right? Like what their most recent login was. So we see that Jaden here came in 19 minutes ago. We can actually see what their last activity was, how many times they've logged in. We can even see things like how many workouts they've tracked, messages sent. So we're giving you some nice summary data about every patient. You can start to use this to start to build sort of a profile of what does good engagement look like for you, right? At a minimum, we need to see these patients utilizing these tools. And we know that while not every patient is going to utilize this, and obviously there will be some differences depending on age and other socioeconomic factors, for the most part, we can start to use their engagement with the portal as at least a baseline tool for understanding, are people buying into the tools that I'm providing them? Now, as we've talked about in a number of previous tips, engagement alone is not necessarily just about technology. Meaning if you guys buy Strive Hub tomorrow, that purchase alone isn't going to make all of a sudden a world of difference in your engagement by itself, right? It really takes a mindset. It takes an effort on your end as a therapist to help explain to the patient why this tool is valuable. But that being said, we can help you understand whether that message has resonated and whether that's come through. So if we go ahead and click into a given patient here, we can actually see some pretty cool information about them, right? So we've got all their summary stats and we've got their care plans that you've created for them, but we're also going to give you a high level understanding of what exactly has that patient been doing. So we'll give you a granular level of, okay, this patient just rated pain and they clicked on a given email you sent, they actually went to the login. We'll give you some other data, right? They've accomplished their goals or whether they've changed their goals. So all of this is in one steady stream. Additionally, we tie this into the patient's progress, right? So this is something that the patient has on their portal. Whoa, zoomed in. Has on their portal. So we can see things like their high score, their weekly progress, or their current streak, right? And all of this data ends up getting tabulated right out for the patient. So again, what it really allows you to start to do is start to connect with that patient, understand whether or not they're actually engaging with the tools that you provided them, and start to understand, start to quantify this, right? What this allows you to start to do is really proactively start to monitor who's engaging and who's not, and intervene as you see fit. Right. So again, one of the nice tools that we tend to use a lot is messaging. So if you all of a sudden had a question for this patient, simply clicking into the messaging system, typing them a message saying, hey, how's it going? that's going to automatically get sent out to them via email. They can hop onto the portal and re-engage. So another way that you can start to proactively reach out to just make sure that these patients are actually staying involved in the process. All right. So again, this is just showing you how to do this with StriveHub. Obviously, we want to show you how these tools work and how you can get the most out of them. But as you're starting to evaluate, we're starting to rethink how we think about exercise prescription tools. Having some capability to proactively monitor how a patient is engaging with the tools that you're providing them, that should really be an important piece of what you end up choosing, and because it's going to play a huge role in how effectively you can manage patient retention on a day-to-day basis. So again, if you guys have any questions, feel free to reach out to us directly. You can hit me up, scott@strivelabs.com, or hit us up on Twitter @strive_labs, or if you want to get in touch with the entire team, make sure to reach out to us at hello@strivelabs.com. All right, as always, it's been great. Thanks for tuning into this Tuesday tip on the wonderful proactive engagement monitoring. Thanks, guys. See you again.